Senator from the Cape and the Islands, Mr. Wolf.
Thank you very much, Madam President. I want to applaud you and I want to applaud the Chair for a great health care cost containment bill in front of us, and I certainly support that bill. But I also rise in support of this amendment from a very different perspective, and I reach across the aisle to my colleagues in the minority party on this. From a business perspective, I'm going to come at this from several angles. First of all, 23 years ago, having started a company with 6 employees, now there are 1,000 employees, we have always seen it as our mandate to provide health insurance. And a premium on an individual at our company has gone from roughly $1,200 23 years ago to between $6,000 and $7,000 now. To insure a family at our company is now up to $18,000 a year per family. And since we see that as a mandate, it is a huge burden on our business. But I also come from the perspective of having been on the board of one of the largest regional tourism councils and chambers of commerce in the Commonwealth that represents over 1,000 businesses, the Cape Cod Chamber of Commerce, and having sat on our Economic Development Council down in the county of Barnstable for the last 15 years, and having co-chaired the Business Roundtable down there, and having sat on the Federal Reserve Board Advisory Council for New England. So it's not just one company I'm speaking for. It's the experience of literally thousands of companies around New England and in our region. The biggest backbreaker for small business right now is the cost and burden of health care that is a mandate in Massachusetts and is literally choking economic development, both future entrepreneurs and businesses that exist today. So I look at this as an economic development opportunity, and I look at it as a crucial move to support business growth and health in the Commonwealth of Massachusetts. So I think part of the study that we're going to be doing, one of the reasons I endorse this amendment is because it is studying, it is looking at how we can do this in a way that will support the individuals and families in the Commonwealth while allow for a robust business environment as well. And I think what the study is going to find is if we can find an equitable and fair way to take the burden off of businesses and spread this burden out in a more fair and equitable way across the Commonwealth, that we will end up in a different form of payment for health insurance. So I support the amendment because it is thoughtful, it mandates a study going forward, it's a pro-business amendment, and I think that in the long run we're going to get there, and this is an important step in getting there. So again, I applaud the Chair, I applaud you, Madam President, for this step in that direction, and I support the amendment. Thank you.
Senator from Suffolk, Ms. Chang-Dia.